Find more podcasts like this one by going to rustymicradio.com.
Oh, here we go, ladies and gentlemen.
It's Adam in the morning.
Enjoy it, love it.
Playing all the good music from classic to old school.
I tell all my friends to listen to it.
Rusty Mike Radio.
Diabetes. We hear about diabetes all the time. It seems to be more and more people we know seems to suffer from diabetes mellitus. And I think there's a lot of mythology about it. Today is World Diabetes Day. I want to thank good friend Robbie for organizing this. He didn't have far to go. His dad is Dr. Yosef Strazynski, who is an expert in the field of diabetes, practicing medicine out of Ra'anana. Dr. Strazynski, are you there?
Yes, I am.
Boker Tov.
Boker Tov.
Now, you're a little quiet. Let's see if we can get you. It's going to squeal a bit, I know, but okay. Are you there?
Yes, I have a little problem with the connection also. I hear you very, very weak. I don't know what's the problem.
Well, I'm going to try. Whoops. I'm trying to give you a bit more. How's that?
Okay. Yes.
Okay, we can hear you. Now, diabetes, let's get some background. It isn't really one thing, is it? It's a group of kind of metabolic disorders.
Well, let's put it this way. Diabetes involves a lot of organs in our body, but by itself, it is a problem limited to one issue only, issue of the control of the sugar levels. Now, of course, the mechanism varies depending on the type of diabetes, because we have several types of diabetes. Okay, type 1, which used to be called juvenile diabetes, that's the diabetes which usually affects young people and teenagers, although we know that it can be also developed by adults or discovered in adults.
Hello? No, that's a shame.
Can you hear me?
Yeah, sorry, we're just getting a little bit of feedback. There you go. How's that?
Okay,
hopefully that's killed that. Okay.
So like I said, type 1 diabetes, formerly known as juvenile diabetes, which affects children and young adults, and type 2 diabetes, which affects adult population. Now, type 1 diabetes is basically an autoimmune disorder. This is the problem where the body produces the antibodies against the islet cells in the pancreas. Pancreas is the organ which produces the insulin, and damage to the islet cells results in no insulin production. Therefore, there is no control of the sugar in the body.
Okay.
Sugar goes very high and causes damage to other organs, many times resulting in damage to the nerves, blood vessels, kidneys, and even brain.
And I don't think people realize that this can be a killer, can't it?
That definitely is a killer. As a matter of fact, until the 18th, even 19th century, it was known to shorten the lifespan of the patient to the early 30s because there's no treatment per se. Well, thank God we do have a lot of progress in the development of different types of treatment against diabetes, but we'll talk about it in a second. Just wanted to give you a little background of the diabetes per se. This is not a disease of the modern era. We know about diabetes described in the Greek writings around 2,000 years ago. This was, at that point, basically incurable disease. The physicians were aware that the sugar is high because of the way they described smell, sweet smell from the breath and sweet smell of the perspiration of the patient. But they did not know anything about the etiology of the disease. They did not know the cures, and just like it was true for all the different types of treatments at that time, it was basically based on the religious beliefs or some witchcraft, herbs.
Right, which isn't very helpful when you're having a diabetic crisis or diabetic emergency.
That's correct. Basically, at that point, that was a death sentence. Okay. Now, That held true through the Middle Ages, basically, and only towards the beginning of the 17th and 18th century, there was some understanding of the correlation between the sugar levels in a body and the diet. So that was the number one attempt to treat diabetes by using a proper diet. Unfortunately, the knowledge of medicine at that time was not yet that advanced, and basically what they did, they starved the patients. They said, well, if you eat, your sugar goes high, so therefore you cannot eat. So they limited the amount of food they allowed to the patient, the amount of fluid which they allowed to the patient. The patient died, maybe not of diabetes, but died of starvation. Okay.
Terrific. Okay.
So,
aren't we lucky we're born in this generation?
That's true. Now, like I said, in 17th century, that's when basically a new science of diabetology was created, if I can call it diabetology at that time. Basically, they have learned to diagnose the diabetes more accurately. It was in England where they noticed the taste of urine of the patients of diabetics being sweet.
I won't ask how they found that out, but...
Well, basically, the doctor decided to test it. I mean, it smelled sweet, it smelled like a flower, let's see what it tastes. He tasted it was sweet, and then through the experimentation, he found out that it's common to all the patients with this type of illness, this type of symptoms, and they decided to basically check the urine from these patients, and that became a standard of testing for diabetes until the beginning of the 20th century, believe it or not.
Wow.
Only in the beginning of 20th century we learned how to test the level of sugar in the blood. Okay? Now this lasted until about the 1920-22, when the first true breakthrough occurred in a treatment of diabetes, and that happened, of all places, in Canada. Two Canadian physicians decided to experiment by using the mixture pulp made out of the pancreas of the animals, and they injected it to the humans, and they noticed that helped control the blood.
And that mixture would have contained insulin, I assume.
I'm sorry?
That mixture would, without them maybe realizing, would have contained insulin.
That's exactly right. Well, and then through the additional testing, they found out that this is definitely the substance which is helping, and that was the discovery of insulin. And then, of course, that changed completely the type of treatment, because it was a miracle. That's what later antibiotics did to the treatment of infections. That's what insulin in 1921-22 did to the treatment of diabetes.
Right.
It was basically a change in treatment which offered a new hope for people who before was basically sentenced to die in a very young age.
Okay.
Okay. Now, like I said, we have several types of diabetes. We basically deal with type 1, and there is also type 2 diabetes. Now, the difference between those is quite significant, because in type 1, which is, like I said before, autoimmune disease, the body is not producing insulin. There is no insulin, okay? Now, in type 2, body may produce insulin, but there is a resistance to the insulin developed in the in a patient, okay?
When we see older people developing diabetes, like my grandmother got diabetes in her 80s, that's type 2, isn't it?
That's type 2. That's right.
Okay.
That used to be called adult onset diabetes mellitus. Now we call it type 2.
Okay.
The reason that also used to be called insulin resistant. Now we do not use this name because we have found out that even type 2 diabetes in many cases will require the treatment with the insulin.
Okay.
development of insulin definitely helped, and in addition to it, the research led to development of many oral medications, and that helped us to control the epidemics of diabetes. Although, even right now, statistics say we have about 180 million people worldwide suffering from diabetes.
Right. It's incredible, except that I think we all know people who are diabetic, all of us.
I would say that if somebody looks into their own families, they will find one or two members of the family
Right.
who are either diabetics or pre-diabetics.
And today, obviously, insulin is still the primary treatment for many forms of diabetes.
That's correct. That's correct. Well, let's put it this way. Not just insulin, that the way of delivery of the insulin to the human body has changed also, which also helps in controlling. I mean, it used to be that we had only one type of insulin. Now we have several types of insulin. The research has helped us develop the methods of mixing different types of insulin in administering to the patient in order to keep the level of the sugar through the day on the even keel, if you will. Okay, to avoid the fluctuation of the sugar from very high to very low. Low blood sugar in itself being very dangerous. It's known as a hypoglycemia, which can even lead to coma and even death if not treated rapidly. So all of those things have, all of these new developments help. Now here in Israel, for example, we have over 4% of population of 7 million suffering from diabetes. Now, out of these people, if we look into the group of age of 60 and more, 10% of elderly in Israel suffer from diabetes.
10%?
10%.
That's a massive figure.
This is absolutely horrendous. Now, not just the diabetes, but because many times diabetes is not treated or not treated properly for many different reasons, that will lead to the complications which will affect other organs, mainly kidneys, but also blood vessels, nerves, formation of the wounds, leading to many times either dialysis, need for dialysis treatment, where the kidneys fail completely to work as the cleansing, as a filter, if you will, for the human body, and patient has to be hooked up to the machine 2-3 times a week in order to cleanse the body of the toxins. Many times, the effect of diabetes on the small blood vessels will result in problems with the circulation, which will lead to the infections, wounds, and even gangrene. Every 4 seconds, somewhere in the world, somebody is losing a leg because of diabetes.
That's incredible. I had no idea that this generation was like
Israel,
that.
Every month, more than 100 people, every month, we're talking about 1,500 people a year, losing a limb because of the diabetes.
And this is avoidable?
It is avoidable. It is avoidable, but like everywhere else in the world, the health system delivery is a problem, because treatment of any disease, and especially disease such as diabetes, which is very involved, is very costly. Now, healthcare organization, HMOs in the United States, or Kupot Cholim here in Israel, those are businesses, okay? I mean, they are established to take care of the sick population, but at the same time, they don't want to go bankrupt doing it. So, of course, there are limitations as to what is done for the patients.
Okay, but surely once somebody is chronically ill, having major surgery and months in hospital, that's going to outweigh any savings by not giving them the treatment earlier.
Well, let me give you a little news flash. Only about a month ago, here in Israel, Health Ministry issued a directive ordering all Kupot Cholim to open the clinics for treatment of the chronic diabetic wounds. Only 1 month ago. We're talking about year 2011.
What happened before that?
Before that, well, there were different clinics, but there was no organized way of treatment. You see, what is important in treatment in diabetes is a multidisciplinary approach. You cannot treat diabetes. A physician, a single physician, will not be able to treat diabetes by himself, no matter what his qualifications, no matter if he's an endocrinologist or if he's a surgeon, if he's a family physician, because diabetes involves multitude of organs. Now, I myself am member of the American Association of Clinical Endocrinologists, but
Right.
I myself, here in my private clinic, utilize to a very great extent services of the vascular surgeons, of the orthopedic surgeons. Only in this way I am able to help the patients. There are limitations
Yeah.
of what one physician can do. Now, the main problem which I see, the main problem is a lack of education to the patients. You see, in my opinion, and in opinion of many specialists treating diabetes, number one treatment for diabetes is not medication, but a proper lifestyle. Is especially a proper diet. You would be surprised how many times I have patients who have been known to be suffering from diabetes for 20, 30 years and who have been known to be taking medications have had no idea of what they're supposed to eat or what they're supposed to avoid. There is not
That's
enough
crazy.
education.
I have a family member with diabetes, and his entire day is built around that knowledge. He tests himself, and his entire day, and he's in tune with his body, and he knows. And I watch him do it, and I realize I suppose there is an expertise to that, but just how much of a sweet pudding he'll eat, and things like that, dressings and all kinds of things. He's totally aware all the time. I don't know how sick he would be if he even stopped thinking about it for a minute.
You're 100% right. You're 100% right. This is if someone is diagnosed with diabetes, his entire lifestyle changes. His entire lifestyle has to change in order to succeed in treatment. Now, one thing which I'm very proud of is the fact that Israel, as small a country as it is basically right now becoming a worldwide leader in research in the treatment of diabetes. As a matter of fact, Professor Itamar Raz of Hadassah University, who happened to be the chief of the Israel Diabetic Association, has been chosen by World Health Organization to lead research, abbreviated named as DCure, research to development of new ways of treating the diabetes.
Okay.
We have right now a very promising research going on in Ben Gurion University in development of new way of transplantation of a healthy islet cells of pancreas to the pancreas of the people suffering from diabetes number 1. And it has been just recently approved by FDA for human testing. That's how advanced.
So you're not talking about here maintenance now. You're now talking about
No, I'm talking about
a cure.
I am talking about the work which is being done right now towards curing the diabetes.
Right,
There's
because all this whole conversation has been about maintaining and controlling, and now you're talking about potentially curing diabetes.
Well, there is a hope. Every research in any discipline which is started is always with a goal of developing a cure as far as medicine is concerned. Many times we fail, but even when we fail to develop the cure, we do find things which at least help in a treatment.
Right.
Okay, so yes, we do hope for a cure. There is a work being done right now, believe it or not, on a vaccine, to develop vaccine, which hopefully will help us prevent development of diabetes.
Vaccine implies that there's an underlying infection rather than a genetic cause of it.
Well, that was the original intent, the very first vaccines which have been developed. But right now, vaccine is basically a generic term. We're talking about the injection of the medicine, which hopefully will allow us to control or prevent an illness. Like I said,
That's remarkable.
Diabetes number 1 is an autoimmune disease.
Right.
Okay, so in other words, if we will create the vaccine, what is autoimmune? Autoimmune means that your body, or the body of a patient, produces the antibodies which kill the cells of your pancreas. So what we are working on is to develop the antibody to the antibody. That would be the purpose of the vaccine. Okay. Antibody which will stop your a substance, developing a substance which will stop your or patient's body from producing the substance which kills the islet cells.
How far away do you think we are from that in terms of years?
No matter how close, how promising it might look, I'm sure it will take another 20 to 30 years.
Right.
That's in my estimate. It will take a long time.
Right.
It
Okay.
will take a long time.
Can we just talk practicalities for a minute? You mentioned pre-diabetes before. Obviously, the most important thing is that the patient goes to the doctor and realizes there's a problem and goes to the doctor. If a person is developing type 2 diabetes, what are the symptoms most likely to come up?
Okay, that's a very, very good question. You see, the symptoms of the initial symptoms of diabetes are quite sedate. Okay, a patient might feel thirsty. Patient might feel that he's all the time tired. Patient might notice that he has increased amount of urination per day.
Right.
Things mundane, something mundane things, something which is not really, oh, I have a boil, oh, I have a spot on my skin, okay? Very
Right.
little things. Now, if people are attuned to their body and they consult the physician, thank God there is a new test which has been developed about 20, 30 years ago, which is called hemoglobin A1C. Okay, now this test allows physician to determine how high was the blood sugar on the average for a period of preceding 3 months. You see, why is it important? When we test, when the diabetics test their sugar level from the finger stick at home, they determine the sugar level at this particular moment. And of course, it will depend upon how long ago did they eat, how long ago did they take their insulin shot or took their medications, and what did they eat, etc., etc.
Yeah, I mean, we all feel, I think, I know if I eat my lunch an hour too late that I feel tired. The blood sugar...
I'll tell you what, I hope I am wrong, but you see, one of the symptoms of pre-diabetic condition is a tiredness 1 to 2 hours after a meal.
I feel tired if I don't eat my meal. My energy goes down. You eat a meal, you get your energy back.
That's right. But
It's fuel.
This is the way the body reacts when you have the intake of the calories,
Right.
if you will. The body pushes more insulin, and instead of burning only the excess, it burns more than just an excess of the sugar in your blood, creating condition known as hypoglycemia. Your blood
Right.
sugar drops. This is the early stage of diabetes. So if you or anyone else has symptoms like that, they definitely should consult the physician. There are many different tests which can be done, such as 2-hour postprandial blood sugar or glucose tolerance test, which is done over a period of 5 to 6 hours. And this will determine how is your body coping with the intake of the energy, intake of the food, and this will determine if you do require treatment or not.
Good to
But
know.
like I said, at this point, in my opinion, one of the biggest helps for a physician is testing for hemoglobin A1C, because this allows us to know what was a 3-month average for the blood sugar, and that allows us to determine the type of the treatment the patient will require.
And that's a test my GP might organize.
I'm sorry?
That's a test my family practitioner might organize.
Absolutely.
Right.
Any physician can order this test, and once done, they may help in making a diagnosis.
Now, I should say, and I should have said this at the outset, that what you do is actually not so much the treatment of day-to-day diabetes, but you get the people where the problems have got more severe and they've got the major side effects and are in danger of losing limbs, etc.
That's correct. My clinic here in Ranana specializes in treatment of the complications of diabetes, not in treatment of the diabetes itself. Of course, I deal with the treatment of diabetes by the nature of the beast, but I specialize in treatment of people who have neglected their body, or whose treatment of diabetes was not sufficient or not proper, who have developed complications such as gangrenes, problems with the circulation, neuropathies, meaning damage to the nerve tissue. And thank God, using the multidisciplinary approach, I was able to develop a method which is very successful in treatment, in prevention of the amputation. And now the overall success rate for the HMOs, if you will, in preventing the amputation is about 20 to 30%. My clinic boasts the rate of over 80% success rate
That's incredible.
in preventing the amputations. And again, the reason for it is we are using a multidisciplinary approach. And being a private clinic, we are not limited by the directives of HMOs or Kupot Cholim of what we can or we cannot do. We do whatever we feel is necessary to save patients' legs.
But in an ideal world, patients should never get so far as to come to your clinic.
That's why I stated before, number one issue here is the education of the patients. Educating public into the early symptoms of diabetes, educating public in the proper dieting, educating them in a proper therapy. Now, the biggest drawback which I have in my private clinic is the fact that treatment being expensive, without help of insurance company, of Kupat Cholim, limits patients' ability to continue in many cases. I had a very tragic case recently where somebody was under treatment and was doing very well, but came to me and says, Doc, I'm sorry, but I cannot come to you anymore because I don't have no more financial resources. Now, whatever we can, we do the sliding scale on a payment,
right.
But we also are limiting what we can do. I have had recently a case, a very tragic case. That was about 2 weeks ago. A patient was sent to me by another physician from the hospital after the minor surgery for amputation of one toe. The patient needed a treatment which we offer here in the clinic. The patient's daughter happened to be a nurse in the hospital. So they came here, I examined them, I told them, yes, there is a treatment which will prevent recurrence of the symptoms, we can close the wound, we can prevent formation of the gangrene in the future. When the patient found out the cost of the treatment, straight at that time, he told me, I'm sorry, doctor, I'm going to go back to the hospital tomorrow, tell them to cut off my leg. I cannot afford this treatment.
Gosh.
Now, what would you do in a situation like that?
It's a terrible thought in the 21st century that a person has to choose between getting the medicine and having a leg removed. It's just...
That's correct. And this is
because
in
of money.
A modern, advanced country, a country which is leading in a research for treatment of the disease. And unfortunately, those things still happen.
One of my listeners has popped up and said there's an Israel Diabetes Association, apparently. I don't know anything about it, but do you know about this?
About what?
An Israel Diabetes Association.
Yes, so this is the organization where Professor Itamar is head of Israel Diabetic Association, correct?
Okay, so I'm going to get that link as well. Apparently there's lots of information there.
Absolutely, a lot of information.
It's been a really important discussion. Today's World Diabetes Day, and it's obviously an awareness exercise around the world. I've learnt a huge amount just talking to you. I mean, thank God, at the moment it's not my issue, but I'm listening to it, and I can't believe this figure of 10% of everybody over 60.
That's correct. 10.5% to be exact.
It's really shocking, and stories like this of people losing limbs. There's a lot to be done.
Well, a lot, and I hope that this little talk we had today will make people more aware of danger and more attuned to their body, and hopefully help them to prevent the problems like that.
Well, we're going to podcast this. I have a feeling a lot of people are going to listen to this over the next few months, and I'll send you the link. And I just thank you very much for taking this time out of your day.
It's a pleasure.
Really, really important. Thank you.
Thank you.
This is Rusty Mike Radio.
Online now.
www.rustymikeradio.com